Another frequently asked question that we get is how our services are different than other outpatient physical therapy services or rehab services. We have found that overhead athletes have been experiencing these injuries, and the injury rates just continue to rise. And while we do have some excellent resources in terms of getting patients back to play or return to sport, there is still a huge gap in addressing rehabilitation along with the throwing pattern or movement pattern. It doesn't have to be only throwing. That is a majority of the patients that we see, but this includes other overhead athletes such as volleyball, tennis, um, anything where we're doing quick motions with kind of our upper body, and especially in throwing athletes. So we have found that it's very important to blend the physical therapy portion along with the movement portion. Majority of the time, the movement piece was what led to that injury or pain presentation. So if we only address the rehab issue, then when you return to sport, that pain is likely going to come back, especially as you start to ramp up. We want to be able to blend both of them together so that you, as an athlete, and we refer to athletes for clients of all ages, but we want you to be able to return to your sport, your activity appropriately with the best type of loading, evidence-based practices, while being able to hone in your practice. Um, we have found that allowing patients to practice these movements in a safe way and a safe progressive way actually lets them achieve and reach their goals. Most of the time for these plans, we have been seeing people have to go on rest. The problem with that is the body needs to learn how to move appropriately. It doesn't always need to only rest. So that's a big component of how we treat our patients and clients. And if you think this might be you or a loved one of yours, please feel free to set up a discovery call with us. Those are free, and we're able to provide a little bit more information to you and answer any questions that you